This is Congresswoman Virginia Foxx with a congressional update. Today I'm going to talk a little bit about a couple of subjects that have been in the news a lot. Actually, they've been in the news since 1937, I guess, but more in the news in the last year or so. They were in the news somewhat under the Bush administration, but particularly in this year we've dealt with deficits and budgets and other issues in this new administration. We've talked a lot about Social Security and about Medicare and the challenges facing them. And I am extraordinarily fortunate today to have Alison Fraser with the Roe Institute at the Heritage Foundation with me. Thank you, Alison, for being with me. I appreciate it.
Oh, it's definitely my pleasure. It's great to be here.
Well, I'm a big fan of the Heritage Foundation and get to as many of your activities as I possibly can. And you all are close to the Hill, and so you've hosted some activities for the Republican Study Committee, and we're always very grateful to you for what Heritage does. And I'd like you to talk a little bit about the Roe Institute and about Heritage. And since you're so gracious to do this, please give a good plug to what you do. Okay, tell us about yourself a little bit.
Thanks for the opportunity. Yes, I've been at Heritage a little over 6 years. I'm the Director of Economic Policy Studies. The Roe Center is named after one of our founders, Thomas A. Roe. And in the Roe Institute, we study a wide range of economic policies. So as you can imagine, we've been really, really busy for the last year and a half or so. It's been a very challenging time. We deal with everything from federal spending, entitlements like Social Security and Medicare, Medicaid, in terms of fiscal policy, taxes, regulation, energy and environment, the financial markets, the economy, jobs. So you can imagine that we've been very busy. And what Heritage tries to do really is two things. We try and put good ideas before members of Congress and help educate them on what sound conservative policy is. And generally, in my area, that means free market economic policy. And we also then try and educate on legislation that's moving. So we have our own proposals, and then we try and educate on what's in play on the Hill on any given day, any given issue. And right now, I think we have about 580,000 members across the country, and even some perhaps internationally. But it's been a very challenging and exciting time to be at Heritage.
And I think you all have a website. You want to mention that?
We do, yes. Our website is www.heritage.org, heritage.org. And there you can tune in and follow all of the issues of the day, and see where Heritage stands and what our ideas and what our solutions are for the challenges that are confronting the nation.
Well, let's talk a little bit about Social Security and Medicare.
Yeah.
How were these programs pitched initially to the American people, and how have they changed over the years?
Yeah.
They were instituted at different times, but talk a little bit about them.
Yeah, great question. Social Security, of course, was the first program that was pitched and passed, that was passed. And it was passed in the middle of the Great Depression by President Roosevelt at the time. And it was pitched as something called social insurance. Excuse me, something called social insurance, which means that everybody in America pays a little something in, and everybody in America receives some level of benefits that is not necessarily directly connected to their level of income. Now that, of course, has changed over time, but the whole foundational premise of Social Security is, I would argue, a strong one, and that is to provide additional or supplemental retirement income security. It's an important part of our safety net. It's been a long-standing, successful program, according to many. It's a very, very important part of retirement security for many of America's seniors, especially low-income women. And when it was, pitched, as you say, when it was being pitched or promoted or sold to the American public, one important distinction that we've really moved away from in this country is that it was originally sold as something that was one part of a three-legged stool. Government supplemental retirement income security, personal pensions, which of course, as we know, have changed dramatically since the 1930s, as well as personal savings. Now, we all know the story, very little personal savings today. Government or public pensions have really changed away from this defined contribution, benefit for life, to a defined contribution where you and your employer share a lot more in your responsibility. But those are both declining. Personal savings, very little of that, and more people are relying today on Social Security as their primary source of income. So you could say one of the unintended consequences of Social Security is, rather than strengthening retirement security for many, they are now much more reliant on government as opposed to self-dependent.
And I think the average payment out in Social Security is a little over $1,000. Is that correct?
I don't recall what the most current benefit is, but it's about in that neighborhood.
Right.
That's right. It's not a lot of money.
No, and people know, if they stop to think about it, they can't live on $1,000.
Right.
But the way Social Security's been sold over the years, people did forget the three-legged stool, and they thought they could rely on the government to take care of them. And that's an insidious thing, I think, that's happened over the years, and it's unfortunate because, again, very few people can live on $1,000 a month.
That's absolutely right. Right now, the notion really is a one-legged stool of government taking care of most Americans.
Right.
Medicare was passed in much the same way. It was to provide health security for America's seniors. It was passed in the early 1960s under President Johnson as part of the Great Society. So we saw a lot of increase in poverty programs pass, or anti-poverty programs, I should say. Medicare and Medicaid went together. Medicare, of course, for America's seniors' health care needs, Medicaid for low-income health care needs. Both of those programs extremely expensive and have grown tremendously, as has Social Security, in terms of benefit and cost over the years since inception.
On Medicare, as I understand it, and I've seen some charts, is much more expensive than it was originally touted to be, and for some of the programs, pays out 7 times as much as they thought it would. Some 20 times as much. Of course, there are different parts of Medicare, but the basic Medicare, if I'm recalling the numbers right.
Yeah, I mean, well, there's 3 parts of Medicare, but the basic problem is not unlike private sector healthcare, and that is that the growth in healthcare costs on a year-in, year-out basis have been growing astronomically. They grow on average 2.5 times faster than the economy. And so it's no wonder that the spending on these programs in particular has really grown out of control. In addition, because it's sort of viewed as free healthcare, demand is really high. So there's a number of problems. Absolutely unaffordable today is the bottom line.
And I think I'm right on this, but correct me if I'm wrong. In both Social Security and Medicare, the recipient pays in some money. However, that money was never put aside into, quote, a lockbox where it would draw interest and be available. Right now, in both Social Security and Medicare, it is the current working people who are providing for the recipients. Is that correct?
Yeah, that's right. I mean, the trust funds work a little bit differently. Social Security, of course, is the big one that everybody talks about, the Social Security Trust Fund, as if it's a trust fund that you might set up for your heirs or a trust fund with special assets in it. Really, it's kind of like, and so what happens is the money comes into the Treasury. It's sort of nominally credited to a trust fund, but it really is, you know, it's all fungible. Money is all tradable. And what happens is, as everybody probably knows in Social Security, they don't spend all of the money coming in from today's workers on Social Security benefits. So they don't put that excess away in any kind of safe asset. They just spend it, Congress spends it on other programs. And so this, you know, sort of notion of a lockbox is really IOUs from one part of the federal government to another. It would sort of be like setting up a college account for your kid and then borrowing money out of it to make your car payment, and all you put in there is an IOU. So yeah, it's really a misnomer that there are hard-based assets, and that's one of the great myths of Social Security, to the lesser extent Medicare.
And so what's the future look like for these programs? Because we hear all the time the term they're going broke. Explain that a little bit.
Well, basically, if we want to set aside the concept of a trust fund, what going broke means is that the costs for these programs really are going to grow so fast and so high compared with the revenues that are dedicated to paying for Social Security and Medicare, that they are going to go broke. Costs are going to vastly exceed these dedicated revenues. And we didn't talk about payroll taxes, but Social Security was designed to be funded solely through payroll taxes. Medicare, a little bit different, because it's not funded solely through a payroll tax. Nonetheless, the important thing is that benefits for both of these programs have been vastly overpromised, and our future taxpayers and younger workers will not be able to afford to pay for these programs and the other important functions of government, like a strong defense.
Right. Well, I think people tend to think that government money is like manna from heaven. They don't make the connection between the fact that any money that the government has is money that has been conscripted from the citizens. Again, there's no such thing, especially federal government money. When I was in the state Senate, they'd always say, well, let's go ahead and pass this because it's federal money. Like it was free.
Oh, right, like it's free money.
Right, exactly. And so you'd have to say, look, federal money is simply that money that's been paid to the federal government by working citizens.
That's exactly right.
Or citizens who've earned something, if not through work, then through wise investments. And then the government then gives some of it back to us.
That's right.
All right, we have a little over a minute left. Let's talk just a minute about how we're going to have a problem with both of these programs in the near future, and what that says about the current debate about health care.
Yes, both, as I said, both of these programs have vastly unaffordable promises in the future. And what we see in healthcare is really interesting. We don't see healthcare reform that's going to slow the cost or slow the growth in healthcare costs that we talked about a minute ago. What we really see, the bottom line here, is a huge new healthcare benefit for another group of Americans on top of the Medicare benefit, on top of the Social Security benefit. And one of the things that's happening is it's being paid for by new taxes and by cutting existing benefits in Medicare. It's doing nothing to take care of this existing problem. And I think we should fix that before passing any huge new benefit.
Thank you. This is Congresswoman Virginia Foxx with the Congressional Update, and I want to thank again Alison Fraser with the Rowe Institute at the Heritage Foundation for being with me today to talk about the challenges with Social Security and Medicare. Thank you so much, Alison.
Thank you for having me.
I'm delighted.
Been a pleasure.